Beautiful day, brave hearts. I'm Dr. Sage Wolfe, and I'm out in Ixtapa, Zihuatanejo, Mexico at the DoD 5-Star World Healing and Training Retreat. Today, I am with my Braveheart Nation Powerpack practitioners. That is a mouthful. How you doing today, lovely ladies?
Doing great.
Excellent. Excellent.
Beautiful. And people wonder all the time, what is a Powerpack healing? Powerpack healing is practitioners who want to advance and even like just clients who want to advance and have this form of energy medicine within their household. Because the Doc of Detox, we carry lots of different energy medicines and lots of stuff you can start pretty light with, like the vitamin D light, the Avicin, the Bioptron, the Sentient Element, all of those, even like the structured water, the Tesla glasses, all of that is going to be like beginner stages of great like healing energy medicine. And that's just kind of like getting your foot into the door. The Bioptron's going to help heal pain and wounds. The Avicin will help increase microcirculation throughout the body by 100% over any other energy medicine device. But then when we come down to the Cardio Med Bed and the Cellsonic, those are two, I can't even place them in the same realm as energy medicine, because it speeds up the process so fast of our clients' healing, our own healing. And so depending on your situation, depending on your state of health and what your goals are, would be depending on what you want to do. And so like if I had a circulatory issue, I'd want to start with the Cardio Med Bed. Or if I have a heart issue, or if I have plaque buildup within my blood, like all of this stuff is stemming from lack of circulation, which is disease can't thrive in a presence of oxygen. If an area has beautiful oxygen and it is totally oxygenated, and you are totally oxygenated, you wouldn't have diseases. You wouldn't have all these symptoms. You wouldn't have all these ailments, whatever you want to call it. And so the Cardio Med Bed is a series of cuffs that you lie down. You lie down on a bed, and it's like a big, big massage bed. But then there's these cuffs that you go in, and they go around your calves, your thighs, and your torso pelvis area. And that, in between heartbeats, you're set up to an ECG machine, and in between heartbeats, that's going to contract and cause a 200% more circulatory like flush within your lymphatic system and with your actual blood flow. And so we want to put you, depending on your situation, between 4, 8, and 20 sessions, even up to 35 sessions if you were in a stage 4 state of any degree. So like you had major heart arrhythmia, you had heart palpitations, you have a tube that's blocked, something along those lines, I would be getting you on the Cardio Med Bed. If I had really bad varicose veins, my cold limbs all the time, and I'm struggling with stuff like this is something that I'd be like, the Cardio Med Bed is adamant, and this is going to increase. The thing is, you can heal yourself. You can heal yourself through diet, exercise, living a perfect day lifestyle, getting out into nature. But the thing is, we allow ourselves to get too stagnant, to get way too lazy. And so we don't give ourselves the proper tools all the time, per se. And so the Cardio Med Bed is gonna speed up that process of your healing like ×5. So that would be what I would do if somebody had, like I was saying, heart palpitations, heart arrhythmia, cardiomyopathy, anything along those lines. The Cardio Med Bed is it. But then we have the Cellsonic. The Cellsonic, there is no other energy medicine device out there that is exactly like it. And so that goes by, it's VPPP, VIPP, very intense pressure pulses. And so, but it doesn't mean it's very intense. It's very intense pressure pulses through a love harmonic. Everything is frequency. So somebody tells you they love you, it makes you feel good. Somebody tells you they hate you and you care for them, something's going on, it makes you feel a little bad. Everything's a frequency. And I always tell people to do a test, especially if you have children, because this is going to teach your children that words are more powerful than anything else, especially how we speak to ourselves. And so take 2 bowls of white rice. You're just gonna soak them in a little bit of water, then drain it. And then every morning or every night, it doesn't matter morning or night, you're gonna have your child or yourself, if you wanna test this out, and you're gonna tell 1 bowl of rice, I love you, you're amazing, you're beautiful, you're nourishing. And then you're gonna look at the other bowl of rice and you're gonna be like, I hate you, you're ugly, you're stupid, you're unhealthy, all of these negative things. And you're gonna watch Might not be over a day, might not be over a week, but around 2 weeks, 3 weeks, a month, you're gonna see like that white rice has just gone maybe a tinge yellow, and that other rice that you were talking to negatively has actually started to mold and go black, because everything is a frequency. So if I'm talking to myself on a daily basis, and it's all about how we take things on, because yes, we have a plethora of emotions out there: love, anger, hate, grief, all these different emotions that we have, but they're triggered from feelings. And these feelings are either going to come through pretty much pain or pleasure. Something's painful from an emotional state, a physical state, I'm going to take it on, and then either I'm going to go into regret or I'm going to go into worry about the future. But the thing is, if I have pleasure when somebody's saying something to me or I'm eating something, I'm going to be in the present moment. Even if it is slightly negative for me, it will nourish my body more than that thing that I was doing that's positive, but I was getting pain out of it. So then that's going to be related to things of like going to the gym too hard and working out angry. And there's so many different rabbit holes we can go into. But let's just talk about the cell sonic. So the cell sonic is very intense pressure pulses, but that is through a love harmonic, and that uses 25,000 volts. And you think about it, 25,000 volts, that's insane. But it's going into your cells. Your cells are pretty much just lightning bolts in themselves. So the 25,000 volts is literally just getting that mitochondria to spin properly. And so we want those 2,500 revolutions. We want the 2,500 revolutions per second, not because generally as we buffer ourselves down, as my light diminishes within me, my cells are only spinning at about 400 to 500 revolutions. And I want to get that back up to the 2,500. And cells all have a specific membrane. They all have a specific function. Like my heart cells are different than my small intestine cells. And same thing with the bacteria, or we have good and bad bacteria, but then most people have too much bacterial overgrowth. But those bacteria have cells inside them as well. So the cell sonic in general, though, was created back in, I think it was 1981, and it was created for kidney stones and gallstones because they wanted to do a non-invasive way, instead of surgery, how to break up these calcium deposits. So they created this very intense pressure pulse through a love harmonic that goes in, and it puts 25,000 volts into each individual cell. So calcification is not normal. Yes, we have calcium in our bones, but our body disperses calcium all throughout our body to buffer down inflammation. So you might have had too much inflammation in your gallbladder or your kidneys, and you weren't absorbing food properly, so you created some kidney stones. So they created this amazing device to go in and create microfractures within the actual calcification of the bone. Not of like your general bones, because it knows what is a healthy cell and what is not. And so if you have mutated cells, so you have stage 4 inflammation, you have calcification, you have blockages of some form of inflammation, it's going to go in there and it's going to create healthy cells, it's going to create healthy circulation. It's not going to create circulation like the cardio med bed would, but it's going to create cellular rejuvenation way beyond the cardio med bed would. So they're totally different energy medicine devices. They're like, I would be doing non-surgical on somebody who had like a calcified hip and cell sonicking that. If I'm not just going to throw them on the cardio med bed and try to expect a lot of circulation to go to that general area, I'd want to target it first. But if I'm just dealing with somebody who has a really bad circulatory issue because they don't move a lot and they've had a really stagnant lifestyle, the cardio bed is going to be like the one and done. But then you have all these issues from, oh, I've had this surgery, because surgery creates more scar tissue in the body than anything else. And so if you've had these surgeries, you've had that hip replacement, you've had endometriosis, I've had fibromyalgia, we know that the body then has been under attack for a while. You are an inflammatory being. And so we have issues in our tissues. We got to go in with a perfect day lifestyle. Dieting is like number one, but the thing is, dieting has to be enjoyable. People like say, oh, I'm going on a diet, I hate it. Oh, you really think those vegetables aren't going to attack your body when you're consuming it now? You really think that food is going to benefit you even though it's a healthy meal, but you hate swallowing it, you're gagging getting it down? Clearly, the thing is, and you don't have to create a healthy lifestyle and make it mundane. And make it redundant, make it a little annoying, make it bitter and not taste like, not flavorful. Life is flavorful. Man, the amount of fruits out there that contain way more flavor, the amount of vegetables out there that contain way more flavor than a burger, than that pizza. The thing is, you've just created such a dysbiosis in your good and bad bacteria that you have way more bad than good now, and so that's all you crave. So we just have to break the cycle, guys, and it's just taking some time and loving the changes. I'm enjoying getting healthy. I'm enjoying my diet. People like nowadays, and I love you all, but we kind of suck. It's like I have to go to work. I have to go grocery shopping. I have to go to the gym tonight. I have to lose the 10 pounds. Are you kidding? You get to go to work. You get to grocery shop. Do you have any idea how many people didn't get to wake up today, and like that was very detrimental on some families? We take advantage of our lifestyles and how we live and the respectability I have for myself every single moment of every single day almost. And so change I have to I get to, because we are just so damn blessed. How you girls feeling?
Feeling great. Yeah. I'm Lorraine in Calgary, Alberta, and I'm working out of the Wellness Hub. And I do the non-surgical and consultations and the cell sonic. I had a lady come in today, and this is the third time that I've worked on her. And she was supposed to be getting hip replacement. And she is walking without a cane, without any support. She's still got we've got to get down to her knees next time and work on that. But using the cell sonic and then doing the non-surgical and then using the cell sonic again at the end makes a world of difference. I mean, the cell sonic, like Dr. Sage said, it breaks up the calcification of the cells. So
that's just it though, because like you're doing it before and after. People are like, why would I have to do it before and after? Okay, if you have a general issue and it's just it's a muscle tissue issue and you have some fibrous tissue within it, and I have some restriction, sure, non-surgical first, cell sonic after, good, you're good to go. This lady, she was booked for hip replacement. It's a little severe. Clearly at that point, then there's calcification around the head of the femur. So we want to go in with the cell sonic because that's what it was made for, to openly, lovingly break that calcification apart. So you put that energy in there first to create those microfractures. And it's not microfractures within the bone, it's the excess calcification, because the cell sonic is only going into the cells that are not communicating properly. And so when we do that, it creates those microfractures, and then you go in lovingly, but you push her, and then you open that scar tissue up, you open all these beautiful arterial pathways, you get this nice healthy lymph and blood flow in there to reconstruct that tissue. Then we put the cell sonic back on a little bit more gentle, because it doesn't have to be as intense of a pressure pulse, but it's still the 25,000 volts. You're still getting the same amount of energy, just not as such hard of pressure. And then it just goes back in as more of that love harmonic and puts the body into a parasympathetic, so the healing is so exponential.
Yeah. Yeah. So this was the third time that I worked on her, and she said, she was really surprised how well the healing was. And just watching her and seeing the way, like her gait, how she's walking and how she's supporting her body differently. And, even the glow on her face when she came in, I said, it looks like you've dropped some weight. And she said, only 2 pounds. But when you're in pain, you're hunched over, you're not moving properly, everything hurts. And when you get out of pain, the joy comes back into the body. That movement.
More beaver dams along the river, the more congested and contaminated it gets, the more bacterial overgrowth. You've already started to open up some of those beaver dams she has, so we're cleaning out the river, which is her lymph and her blood, like lymphatic system and her blood. And so by doing that, you're seeing the life come back into her. She doesn't need to lose 10, 20 pounds for you to be like, wow, I'm noticing so much change. Right now, you're seeing her life force come back in. And that's just showing that, like, it looks like she's losing the weight, looks like she's feeling more vital. All of it is coming together as a change. It's not like the one thing.
Yeah, that's the beauty of having this cell sonic. You know, it makes it so that when I do the non-surgical, it's easier. It's easier to open up those areas. And then the healing afterwards is amazing when you follow again with the cell sonic. Yeah, it's beautiful. So anybody in the Calgary area who is looking to get some Wolfe non-surgical or cell sonic, you can give me a call. I'm also carrying all of the Doc of Detox products. And when you purchase here, you won't be having to exchange the US to Canadian. So it's a little bit of a benefit. So my number is 403-605-9216. And you can call and we can get you set up and get you moving better, moving and grooving. And again, restoring that quality of life. We do not need to be in pain. The body knows how to heal. All we have to do is give it what it needs.
Beautiful. And so, Deborah, where are you at? Tell us a little bit about what's going on, and have you had any cool successes lately?
Yes. In fact, I don't want to brag or anything, but I think all of mine are successes because I have never had someone actually walk out of here and say that they were dissatisfied. So that is it's a bonus, but I don't even doubt it one bit, because when you know the work, when you see the work and you're doing it, it's going to happen. So, it really depends on how, people age, how old they are, what they've been through in their life. The more traumas that they've suffered, the more, the poorer of a diet that they've had, they're going to have more issues. And sometimes it takes a few more treatments than an average person. So I'm here in Stuart, Florida, and Dr. Sage, we're going to be hosting you here in the month of June. So that's going to be exciting. And this is the last stop in the United States. So for those who are interested, I think everybody should check it out on bhnuniversity.com. And you can check out the classes. It'll be the Whole Life Coach, which will be June 5th through the 13th. The Wolfe Non-Surgical is the 15th through the 26th. And then the Pelvic Restoration Masterclass will be the 28th through the 30th. And that is in the month of June. Dr. Wolfe will also be doing 2 lectures. One will be on May 29th, and then he will do a day with the doc on June 2nd. Dr. Sage Wolfe will be here doing a lecture on June 12th, and Lorraine will be doing the lecture on June 25th for the pelvic masterclass. So we have exciting, fun times here coming up. We're close to the beaches. It's going to be a lot of fun. People are going to learn a lot. It's going to be exciting. And anybody that has any questions, you can reach out to me. And my number is 305-342-9559. And you can check out here in Stuart, my practice is Stuart Health and Healing, and my website is stuarthealthandhealing.com. So let's see, one of the recent cases that I had, she's a lady who is about 71 years old, and she was in severe pains. What started with neck pain that went down her, in her trap, into the shoulder, all the way down to her fingertips. Severe enough that she actually had to be on pain patches. She could not, okay.
7, and that C7 nerve controls pretty much your tricep and your extensor muscles within the wrist itself. And so that's totally a normal thing to experience. It doesn't mean it's normal in general for my body to have that pain. But if you have issues in your tissues, you have an issue going on in the upper back and neck area, and you think the numbing in my hand is like normal, it's not natural, but it is normal if you have a scar tissue issue, because it's just choking off that cervical 7 nerve. And then it also can then affect the brachial plexus nerve, which controls all the hands. So it really depends. You want to kind of just make sure that she knows to start like activating, clapping, doing some of her own work on that to see if she kind of gets any like results prior, because then that's going to give Debbie a way easier job to kind of navigate where to go to first.
Right. So she did that. She was clapping. She was doing castor oil packs. So we did 3 treatments on her, and she also did the Cellsonic. And after the 3rd treatment, she had complete pain-free. So she's been for the last month pain-free, and she is coming back into town because she doesn't live here. She lives a little bit away. So she's coming back into town, and she called me up. She says, I don't want this stuff to ever come back. We're doing some more treatments. And I said, perfect. So she'll. Right. Mm-hmm.
Thanks so much, you fixed me, see you later. And then they come back
Right.
2 months later and they're like, why is it back again? Because you didn't get rid of the belief, or you didn't get rid of what was so rooted deep. And so we have to go back in after you don't have pain. This is for anybody out there who's going to any of my non-surgical practitioners that have ever been trained. If you go to them and your issue has then been dealt with, I want 2 more treatments after that, still consecutively, to make sure that there's a new sheriff in town. We restructured that tissue and I feel vital again, and it wants to stay that way because our bodies are meant to break down. So that was just one of the weakest links or one of the weakest injuries that you've had, saying, oh, I'm aching right now, pay attention. But normally we numb it out. But if you paid enough attention, you worked on it, you subsided that issue, I want to work on it to strengthen it afterwards and just to make sure that issue is dealt with. So that's somebody who has true love for themselves.
Yeah, she's amazing. At 71, she's doing wonderful. She is taking back, that she's gone through a lot. There's been some issues and, within her family, and she's dealing, but the issues still, touch you, and that's going to affect you. So, but she's a wonderful person, and doing the work that it takes, like you say, to love herself. And everybody around her is like, why are you doing this? Why don't you just go to the doctor? And that's the biggest thing, is that you really have to stand up for what you know and what you believe in, because what is a doctor going to give you, which is basically nothing but a pain patch, or they're going to try and cut into you, and that's your only options. And when you know that there are other options, like Wolfe non-surgical and the Cellsonic, you don't have to go into the, the part of being cut on or living in this pain. And, most people, they associate getting old with just being in pain because that's what they've been taught their whole life. And I will never get old and I will never be in pain. So how is that?
Love it.
So, yeah, the work is truly amazing. The technique is amazing. The Cellsonic is amazing. And I am so blessed that you guys...
I do just want you to touch on it too. It is not just for humans. People love their pets nowadays, and you've had some amazing results with your pet. Yeah.
Yeah. I mean, Emmett is... Emmett is, let's see, that he should have been gone on June 30th of last year. So we're about 10 months into it. He's over 15 now. He's still thriving. He still does his walks. And, when you guys talk, I'll go get him and I'll show him at the end after you talk to Magdalena and stuff. But it's amazing. We do non-surgical. I just did his spine. He gets Cellsonic on the spine. He gets Cellsonic on the neck, on the head. And it's speechless over what it is. I'm so blessed that you guys came into my life. And if for anybody out there that questions whether or not that they should take this class, there's absolutely no question in my mind that it only will benefit you. So it's going to just help, for you to learn the techniques and have the knowledge that you can, teach your family, your friends, how to live without pain, how to really live the best life that you possibly can.
Thank you for sharing, darling. Magdalena, how's it going? Dr.
Hello,
Wolf's coming out to
Doctor.
see you pretty soon.
Yes, pretty soon, on May the 4th.
Yeah, so where are you at? How have you been? You got the Cellsonic going, you have some of the energy medicine, you have taken my class a few times. So
Yes.
how do people get a hold of you?
Yes, so they can get a hold of me. I do the Wolfe non-surgical and I have the Cellsonic. So I have a great teacher, Dr. Sage Wolfe. I am in Toronto. My number is 416-669-9351. And my website, torontohealthandhealing.com. And you are welcome to give me a call if you want treatment, Cellsonic or Wolfe non-surgical. And we could get we can be healthy again. We learn so much. We can learn so much about nutrition and emotional intelligence and live 100 years. Yes, we can all do it, my friends.
Healthy to 100 for sure. Thank you, darling. So guys, and the thing is, when you do purchase these devices, yes, they're pretty expensive, but you can become a practitioner through it. This is something I wouldn't say some people, few and far between, because like I said, some of the devices are a little expensive. Some people have literally just bought it for themselves to have in their own household for them to do energy medicine here and there for their family. I think that's amazing. A lot of people, not so affordable. But the thing is, if you want to have this in your practice, this is part of your practice. This is a therapy in itself. And so by getting these devices, we want these practitioners, we want these people around the world with these practices to carry these devices so we can start healing the world one person at a time, starting with yourself. So if you purchase either one of these devices from the CardioMed bed or the Cellsonic, you do get a free New World Practitioner certification. So that is the Whole Life Coach and the Wolfe Non-Surgical. And then you'll become part of like the wholesale and the VIP program as well, and the affiliate programs. And you're on the weekly practitioner trainings with us, so you can continue growing, learning, and we work for you, and that's what we want. It's not like we're just doing this because like we need more business. We're busy all the time. I am booked up almost completely this year. I think I have like maybe 2.5 months in total of availabilities for like non-surgical bookings. And those dates are on braveheartnation.com if you're wanting to book me or to come to Ixtapa to get trained in Wolfe's Non-Surgical and the Perfect Day Lifestyle and energy medicine. Or if you can't come out to Ixtapa, I travel around the world. I'll come to your practice, your home, your care center, whatever you need, and I will train you in the comfortability of wherever you are in Wolfe Non-Surgical or the nutritional and the Perfect Day diet. But like I said, we travel all around. We're gonna be in Florida next for this. This is gonna be our last stop for the United States this year, I'm almost certain. I will probably be doing a couple more trips back there, but that'll once again be for those personalized treatment and trainings or personalized course trainings. So we have the Wolfe Non-Surgical and the Whole Life Coach going on, the New World Practitioner training in Florida. From Florida, I think we go, in all honesty, to Australia, guys. I would need to just kind of get a refreshed on that. Yeah, so we go from Stewart, Florida, and then we go to Coffs Harbour, Australia. And then we will be in Ixtapa, Mexico, kind of wrapping up the year. But in between, like I said, I do trainings all around the world. So if you can't come to us, I can come to you guys. I just want to say thank you all for hopping on and joining if you stuck with us the whole time. If not, I hope you're having a beautiful day. Thank you to my wonderful practitioners. Let's say hey to Emmett. Let's let this 15-year-old gangster show up and say, hey, this guy is so adorable and he actually has so much life in him.
Yeah, so he turned 15 the end of January, and I look at other dogs that are his age. And he, he doesn't walk like he used to, but he still puts that pep in his step and he wags his tail. And you can look in his eyes. He just wants to eat, and he has the appetite. He's just a loving sweetheart of a dog. So I am so grateful that he is here with us. And the only reason that he is because I learned by taking the whole life coach and the Wolfe non-surgical. And this little one gets Wolfe non-surgical. He got it 2 nights ago. Tonight, I think I'm doing his neck and his throat, or over on the side, doing the whole side around his ear. I just work on him about 15 minutes every other day. And Taz gets his treatment. He's a 60-pound Australian Shepherd, and we deal with some issues with him, but he's going to be 4. So if you learn this and you start taking care of the body, whether it be your animal or your husband, wife, child, if you do this, the whole time a person is around, you'll just keep those joints open. You keep the whole body open. You'll never get the blocks. And that's what the beautiful thing is, right?
Well, once again, guys, I wanted to say thank you so much for hopping on. Today was the Powerpack Braveheart Nation show. So thank you, ladies, for hopping with us. Together, we are stronger. We are Braveheart Nation. I hope you all have a beautiful day. We'll see you in the next one.
Bye.